Welcome again to the celebration of the World's Menstrual Health Day, where women, their resilience, strength, hard work is seen, and also perseverance. Trust me when I say so. So today I have a very, very important guest. I'm back. Is a global child strategist and advocate. Menstrual Health Day. And
Such a good question. Um, I think what I would say first is really thinking about where does the support and resourcing go, both from a government standpoint, and also I work in philanthropy from a funder standpoint. Um, and I think the menstrual health in general has been neglected and is identified as taboo, and often gets wrapped up in like sexual and reproductive health areas that where there's stigma, where funders want to avoid, where government wants to avoid, and so we don't see it become a part of education programs, even when there is resourcing and support for education. The other thing I would say is that we should be listening to the young people, those that are experiencing these challenges and really and are at the forefront of where this education and support needs to be. So I would say engaging young people in the conversations and decision making to better support reproductive health education throughout the world for young people. We need it.
those are very beautiful words of wisdom, insights that you said, Sheila. And talking about that, as I was discussing earlier with Daisy, my fellow colleague, and also a teenage like me, we were discussing where we were like, you as a funder, what's your take when you see condoms are being given free here in Kenya, right? But menstrual products or sanitary towels are not given for free, whereby you have a man or a boy going to a man, let's just say a man, going to a chemist and receives it for free, but you have a girl going, maybe you're going to a public toilet, public places, there is no sanitary towel for free. And that leads to early teenage pregnancies, that leads to early marriages, that leads to spread of STIs. What's your take on that as a funder?
Yeah, as a funder, it's a great question. Um, I think as a funder, yeah, I see this happen all over the world. We can have access to resources that support men, but when it comes to what women need, what girls need, that it's not supported in the same way. That it's expensive to have your period, and not have the support from local health centers, from government programs and things like that. And then of course we know then the impact that has when we don't think about the health in that way. So what I would say as a funder is I'm echoing the same, but that to really understand the most pressing issues that children and young people are facing, working directly with young people, talking, having these intergenerational conversations that help identify where the biggest pain points are. And as funders are thinking more about investing in girls and gender equality, thinking about the way in which menstrual hygiene, menstruation health, reproductive health must be incorporated into the bodies of work that we do, and not shy away because of fear of stigma or fear of being involved in taboo topics. and again, like coming back to the listening to young people saying, this is important, this is needed, and really responding to that.
Okay, that's a very beautiful insights you said, Ashila. And I believe also, as I was talking, I will refer to that because we talked about a lot of things, and you were like, parents have a role to play in here. Apart from pointing out to schools, pointing out to the government, pointing out to the funders, pointing out to the society, we have the role of parents.
Yeah.
You see, most of us, me and Daisy, when I started my periods, I was so afraid to talk to my parents.
Yeah.
I went to talk to friends because as teenagers, when we are growing, we are drawing off, we are drawing away from our parents.
Yeah.
But when we were 12 and what's your perspective on it? Because you find out that I didn't speak to my parents because I was like, what if, because the first thing I had, I'm bleeding. I forgot what I was taught in school. I was like, I am bleeding and I'm feeling pain. So the pain was the cramps, and now the bleeding was now the menstrual flow. And I was like, I'm bleeding. I couldn't trust anyone. You see, like the issue, how many girls are out there today, they're not trusting anyone. You see, today we mark 28th of May. It's 28 days. Approximately a big number of girls are going through the menstruation today, right?
Yeah.
So like how many of them, maybe it's their first time, they're afraid. From your own perspective, how would you address that?
Yeah, great question. I mean, I remember my first period. I was at camp, and I really had no idea what was happening to me, and I felt so much shame. I felt like I felt uncomfortable to bring it to my mom even, and she had never brought it up to me.
That's the way.
Yeah. So I think parents have such an important role to play, and again, kind of coming back to that taboo and stigma of, what we do or do not talk to our children and young people about. Such an important role to play. I think being more open and honest and transparent with their children, boys and girls, right? But boys and men need to know about menstrual hygiene as well, and so having those conversations so it's not so uncomfortable. So when someone does, begin their period or has had it for a while and needs somewhere to go and talk about it, it feels safe to go to a parent, to an adult. I'm not a biological parent myself, but I do have a sister who is much younger and in and out of my care. She's 6, so we're not there yet, but I've already been thinking about, like, all right, what are the ways in which I talk about things now with her, so that she can feel open to bring these up and have discussions. And I think governments and schools and whatnot have a role too to help parents think about this. Maybe if parents haven't gotten the education themselves as well, how can we support them to support children? How can we create peer supports that, okay, this might be uncomfortable for you to address. Talk to other parents who have done that, or talk to other parents who are facing similar challenges, creating ways for them to come together and invest in that as well. I think is really important. Because it's the first line of a child or youth's opportunity to engage with those in the world around them.
Yeah, actually the key point here that I've taken home, that I will take home for the rest of my life, is be honest, transparent. And also I feel like another good mechanism that schools can use is during parents' meeting, during AGMs, teachers, board members, come, speak about this. We have guidance and counseling in school. We have counselors in school. They know about these things. When you call parents to talk about the girls, the boys' academic, please inform them about their menstrual health, because it's important. It affects how we think, how we perceive things, our confidence and our self-esteem. So onto the many questions I have, you've answered almost all of them. So what are some key initiatives that you've seen successful addressing menstrual health challenges for children in different parts of the world?
Yeah, that's a great question. I've seen a couple of things. So I work with an organization as well called Parity Lab that supports grassroots organizations across India that are addressing gender equality, gender-based violence. So we've seen grassroots organizations coming up with solutions around, creating reusable pads, things of that nature, distributing those, having conversations with community, like play theater for community groups, or like you're saying, having schools. That's happening across the world. I know particularly some in the U.S. around reducing costs and reducing taxes. Our pads and tampons are taxed at this crazy rate.
And they're very expensive.
They're very expensive. They're very
It's
expensive.
essential. Please, the government. It's essential.
It's essential. Absolutely. So there's activist groups that are advocating for the abolishing any tax associated with it, and then reducing cost, and finding more ways to have access. I think the other thing is newer solutions, like I don't even know the best the newest and greatest terms for them, but that are not just pads and tampons, but they're like reusable, more sustainable methods. I think they're important. I think sensitization I've seen really great sensitization for schools by community leaders, by young people, encouraging girls to still be able to go to school when they are menstruating, as many girls around the world don't have that opportunity. So things like that I've seen, and I really echo that. I see that coming from the ground up in the young people themselves.
Actually, you've answered 3 questions. But let's go. I feel like that's another important issue. Like the government should reduce the tax rates when it comes to sanitary towels, because these are essential things that are needed. I was having a conversation with my friend last Saturday, and he was telling me to go speak to a group of girls, of what these are teenage girls who are pregnant, who are going to do premature sex, because they need pads, they need sanitary towels, because they are afraid. Their self-esteem is not that well. And Daisy said, they're saying that her mother always say, no man is going to help you if the man is not your father, without expecting anything in return. So like we have these people who pretend to be nice in the name of trying to help these people buy sanitary towels, and this is real. These things are happening. So out there, as we commemorate the World's Menstrual Day, I want to urge all of us, premature sex is not the solution to it. We have a founder here, Sheila, who is an amazing, I would say, when God created you, he knew he knew what you were supposed, like your role had already been outlined. So like I keep telling girls, like that is not the only solution. We have a lot of solutions, and this could happen if me, you, them, us come together to sensitize, to create awareness, to do workshops in community, in schools, in churches, in mosques, depending where you stay, with your siblings, with your sisters, to ensure that menstrual health is a very essential topic to talk about. And as we are discussing it here, celebrating it, and just acknowledging the resilience, the strength of every woman that is out there, we want to tell you that it's essential and very important for us to know that it's never the end of the world, and your self-esteem should always be up. As a girl, as a lady, as a woman, we are part of we are very, how do I say it? We are a very important part of this society.
Absolutely.
We are, and we are, like, I would say women, both women and men. I remember when I was in primary, boys were being excluded when it became to a talk girls were having. They were being excluded, and this happened. One of the girls really messed up on their uniform. Believe me, not the girls who are being spoken to were the one who helped. The boys who are being excluded. So imagine if boys are included in these topics. We raise a
Yes.
society that is loving, kind, and watching out for one another. We'll not have these cases, we'll not have teenage pregnancy, we'll not have early marriages, we'll not have spread of STIs and HIV and AIDS. We'll be raising a society that is healthy. We'll be raising a society that is informative and ready to help out. So as we celebrate this, I just want to urge you, be smart. You are a woman, a very important member in the society, and you can see what she's achieved. It's not all about specific, it's all of us. So going to the last bit, and then we discuss about the girls who are in war. Their countries that are being faced with conflict. The last question, in your experience, what are the biggest barriers young girls face in accessing menstrual hygiene products, and how can we overcome them?
Such a great question that I don't even think I will have the fullest, best answer to, but I'll give it my best shot because I agree that this is so important. Yeah, I think we need to. I think we need to ensure that we, again, as funders, as those that are setting policy, those building programs, are not shying away, or not, avoiding conversations or programming or supports around menstrual hygiene, menstrual health, and reproductive health more broadly, because it can be complex, and it can be a place where I think funders or governments or programs feel like they might get called out if they say something wrong or do something wrong, and so they end up just avoiding it completely. So I think kind of on a structural level that funders and philanthropic entities need to be considerate and considering the importance of this in quality, in education outcomes, in health outcomes, how important it is to focus on this as a part of the work that they do. I think that's one. I think some other barriers are just how do we find ways to, build resources for menstrual hygiene, like it's a part of our essential health system. If we've got a health clinic, if we've got a resources in this way that enable more girls to have access. And I think, like you said, involving men and boys in this conversation so they know how important this issue is for the whole world, right? It might be affecting us most in real time, but it is affecting them just as much in terms of the impact on society. So getting them to care, because that's 50% of our society, getting them to care and talk about these issues and make sure that we have the resourcing of sanitary towels and things like that in all of our supermarkets, in all of our in other spaces, in emergency response situations. It's just, I feel like it can so often be neglected, and putting it there out and the forefront as something that we have to think about and address.
Okay, so like, how can we empower young girls to feel confident and informed about their menstrual health within the child welfare system?
Great question. Well, when I think of the child welfare system, I particularly think about children who don't have parents, that don't reside with their parents, or don't reside in a traditional way. They may not have the same guidance and support that those with parents or primary caregivers quite provide. So again, I'm thinking about incorporating this into the kind of competence and whatnot within a child welfare system. Thinking about more ways to make connections to trusting adults, to trusting caregivers, that they can have these conversations with openness, meeting them where they are, right? Not just expecting them to come to us to ask, but being thoughtful ahead of time and preparing children and youth for this. Yeah, those are just a few of my suggestions.
Yeah, that's amazing. That's amazing. And I always say, and I will always repeat, the most important word you could ever utter from your mouth is the help. Seeking for help doesn't mean you're stupid. It is the most important word, because instead of going for other alternatives that are harmful, instead of going for teenage pregnancy, early marriage, a spread of STIs and everything, can you ask for help? And please, when you're asking for help, ensure you ask to the right people, because not everyone. You could be asking for help, and you're asking for teenage pregnancy, early marriage, and as you're asking for a disease in a way, in disguise, and you don't know. But remember, as we're celebrating this day, the most important word you could ever utter is help. When you ask for help, at least you made a progress, okay? And also be informative. So we're talking about generally the world and celebration of the menstrual health day worldwide. And also this brings to me the girls or the teenagers, the children whose countries are in conflict. They are at war zone. How are they coping during this time? How are they feeling? You know, are they accessing the necessities they need during this time of month? Yeah.
I can't imagine that they are supported very well within this way. I mean, I think we see in general society we've been talking about that it's often so neglected, and even in emergency or crisis or things like that, even more so neglected, because it might not be seen as, you know, the most important thing that is provided in this context. So again, I think thinking about, you know, as we address even those in emergency contexts, how to incorporate and build with existing structures, with communities, with community health places and spaces. I think creating more spaces where peers can come together and have these open and honest conversations with one another as well. And like you said, a trusted adult, a trusted person in your life that has your best interest at heart, like being able to have a genuine, honest relationship with them where you can go and ask for help and ask for advice is so important, because we all need each other. None of us are making it through on our own. It really takes us all banded together to address the biggest challenges like this one within our society.
Yeah, we always stand together to address challenges in our society, as she's noted, please note that. And we are almost coming to an end of this, and I would love for you to answer this. In your experience, what are the most urgent inventions needed to ensure menstrual health rights for girls in conflict zones?
Can you repeat that question again?
In your experience, what are the most urgent interventions needed to ensure that menstrual health rights of for girls in conflict affected areas?
Yeah. I mean, I would say that how would I know? That I would say we should talk to girls and young people in conflict areas to really understand from them what's been done, what's worked, what hasn't worked, why, what solutions, innovations do they have. I'm sure there are just, you know, anytime I would say that I go down to the grassroots level and work with young people, work with community leaders that are developing solutions for themselves, like those are the innovations that work. Those, you know, based out of innovations that are based off of need and desire, that address challenges that people are experiencing themselves, always the best, most sustainable, powerful solutions. So I bet that's going to look, you know, different somewhere in Nepal than in Kenya and in the United States. But really talking to the young people in those contexts, and hearing from them what would work best, and then getting funders, getting philanthropy on board with supporting young people's ideas, with innovative ideas, to invest in and support those.
Okay, this question has just struck my mind. How can we advocate and create awareness for girls about their menstrual health in war zone? Like, how can we do that? Can we just make a specific thing or a specific advocacy only for girls or teenagers or girls going through where there are areas is in conflict, how can we help them? How can we help them feel that they're involved, they're seen, they're heard, and they're also engaged?
Seen, heard, and engaged at the same time. Absolutely. I think, that yeah really comes down to like the fundamental values of who is engaging, what are they doing in these crisis settings. I think getting really down to the grassroots level, just talking, just having like open conversations with young people, having communities, community leaders being able to have open conversations with young people and their experiences so that they can then really rise those up. It takes time. I would say that, I think one thing that keeps funders away from doing these types of practices is that it takes time to do it well, to really talk to people on the ground, but that building relationships and having open conversations, reducing those power differentials that exist between kind of a program designer and someone who might benefit from it, or an education, policymaker and a student, like breaking down the power differential that exists between those, and being able to come together in really truly authentic and equitable conversations.
Okay, lastly, what role can global organizations and communities play in providing sustainability solutions for menstrual health in war-affected areas?
Yeah, absolutely. And I think it's just, taking a rights-based approach, and that this is a right for girls to have the support they need and deserve. It's a right. It's an absolute right. And so I think, incorporating that lens, that value into the funding that is provided, that the programming that is provided is imperative. I think the focus can so often be, what is the absolute emergency need at this time, without looking towards what are also fundamental rights that people need in order to thrive in society, and this is one of them. So incorporating that lens into the work that they do, and taking more risks with funding in that area, despite stigma, despite potential taboo topics, taking that risk to really support girls where they are and what they need.
Okay, you talked more about funding. So the last bit, how much do you guys fund philanthropic organization that deals with this menstrual health awareness, trying to help these girls, teenagers access sanitary towels, aware of their menstrual health, and how much, like if we were to speak of that, and if there is an organization that is willing to do that, how much can you guys fund?
Yeah. I mean, gender equity by itself is one of the least funded areas in development work and global work in general. We know that it's less than 0.1% of development funding goes towards gender equity, and I would say within that I almost have never heard of anyone bringing up menstrual health in a part of this within this funding world. So I think it's extremely limited, and just does not get the attention that it deserves and needs, and particularly coming from like a children's rights perspective. Again, my work is in children's rights and well-being. It's a neglected area for funders, and I think it's something that they want to learn more about, in order to make a difference and in the outcomes they already seek, right? You see many funders want to improve education, or improve education outcomes, or improve health outcomes, and target really, in on a school, and what is the curriculum, or in a health center, like what are the testing that they have, and what are the disease focuses, but not thinking about the more societal components of how do you make it through the world as a girl, as a woman, on your period, and thinking about that in the work that they do. I would say funders are not addressing that in high numbers, but there are a few activist organizations that are out there that are really trying to change that.
Okay, thank you so much, Sheila. This has been an amazing conversation, and I believe you watching as you've learned 2 or 3 things that you're going to take home during this day. And I will not finish without giving you my last quote, parting quote. And this goes, Menstrual Health Day, it's an essential to reflect on the progress made in breaking the stigma surrounding menstruation and advocating for better menstruation health rights. By raising awareness, promoting access to menstrual hygiene products, and supporting women and girls globally, we move closer to a world where menstrual health is recognized as a fundamental aspect of overall well-being. Let's continue to work together to ensure that every individual has the resources and support they need for their menstrual health. I was your host, Sheila Luango, and this has been an amazing conversation about World's Menstrual Health Day. And I believe wherever you'll be celebrating this, as a woman, as a teenager, as a girl, as a lady, as much as you're female somewhere, we are proud of you, and we know you've been striving. You are strong, your resilience, your strength, your hard work will be seen by society. Do not shame away from such activities that this is a secrecy. No, it's not. It's a simple biological process that all of us have to undergo. Thank you so much. I've been your host, Sheila, and it's bye. Bye.
Bye.